Good evening, everyone. Welcome to our live session on an important and timely topic, cardiac arrest during winters. I'm your host, Maitri, and today we are fortunate to have with us Dr. Vanita Arora, Senior Consultant, Cardiac Electrophysiologist and Cardiologist.
Thank you, Maitri, for the kind introduction.
Welcome, Dr. Arora. Absolutely, Dr. Arora. Let's dive right in. My first question, why is there an increased risk of cardiac arrest during winters?
A very important question in today's scenario, Maitri. Thank you for asking that question. The winters have set in and our population, especially the elder population, they always delay to take care of their health. People who already have cardiac issues also have an increased problem during this tenure, and people who do not know that they have cardiac issues, they also develop more problems during winters. Now in winters what happens is that there is vasoconstriction. What is vasoconstriction? The arteries in our body, the blood vessels in our body, they constrict to conserve the heat inside the body. Now when they contract, even the cardiac arteries, the arteries which are supplying blood to the heart, they also constrict themselves, and this is known as vasoconstriction. Now with that, what happens is, if there are blockages already existing in those arteries, they tend to give symptoms to the patient. Symptoms can be in form of angina, which is the chest pain, or heart attacks, or the heart attack can be so severe because of this vasoconstriction that it can result into sudden cardiac arrest.
That's insightful. How can individuals with pre-existing heart conditions better protect themselves during the winter months?
A very important question for patients who are already diagnosed for coronary artery disease. Now these patients have to take more precautions during winter seasons. Our elderly population, they go in for morning and evening walks without realizing that early morning walk, especially at 4 o'clock or 5 o'clock in the morning, is actually not good for their health. The morning walks are very good for health, but during winter season, going too much early in the morning can actually be catastrophic or have a detrimental effect on their health, because it is so cold and they don't realize that in that cold, the vasoconstriction of the blood vessels can happen, giving them symptoms. So what they should do is, instead of going early in the morning, they should wait for the sun to rise and start going around 12 o'clock or 1 o'clock. Instead of early morning walks, they should make it around a early afternoon walk, and that will be good for them. The evening walks, instead of taking them at 7 o'clock or 8 o'clock in the evening, they should do it around 5 o'clock or 6 o'clock, or start doing walks only once a day, that also when the sun is in the full bloom, so that the temperature is monitored and the vasoconstriction can be prevented.
Excellent advice, Dr. Arora. Now, regarding lifestyle factors, how can someone modify their daily routine to lower the risk of cardiac events during winters?
The daily routine has to be changed during winters. They should have more of warm products. The consumption of tea and coffee definitely goes up, but instead of just sticking on to tea or coffee, they can have hot milk, and they can go on to having hot teas, herbal teas. Instead of adding caffeine and nicotine, they can go on to having hot herbal teas. And plus they should take more of nuts, which provide little warmth in the blood circulation. Now when I talk of nuts, they can have almonds, they can have walnuts, pistachios should be avoided, and of course the kajus, they should be avoided. And almonds and the walnuts, they form a very good combination of nuts. They should start taking that more. The eating part, the meals part, we have a lot of green vegetables like saag and palak during winters. So instead of having these vegetables in the evening, they should have them in the afternoon, because in the evening time, if you consume saag, makki ki roti with makhan and palak paneer or something, that becomes very heavy. So they can start taking these meals in the afternoon rather than having them in the evening or in the dinner time. Apart from that, Of course, green vegetables are too much in full bloom. They should add that to their meals, and a lot of fruits are available. They should eat that and make themselves healthy.
Great tips. Moving on, can you shed some light in the signs and symptoms that individuals should be mindful of during the winter season that may indicate a potential cardiac issue?
During winters, cardiac issues definitely increase. And since our activities become less, in case anybody is a diabetic, the diabetic levels go up, the blood pressure readings go up. So you have to be very careful about the symptoms and discuss it with your cardiologist. In case you are getting out of breath or having discomfort in the chest or heaviness in the chest during the routine activities which you were not having earlier, you should bring it to the notice of the doctor. Instead of making the diagnosis yourself, please leave it to your cardiologist to diagnose your symptoms and give you the answer, because you may require intensification of your medical therapy, you may require intensification of your blood pressure therapy. Do not start complaining that why you are adding another medication for the blood pressure. Winters, everybody has the surge of blood pressure, so the therapy has to be increased or modified to the requirement that your blood pressure remains controlled. Even the cardiac medications sometimes have to be increased so that you do not have symptoms and they are well taken care of in time and they do not give you any deleterious effect.
Important information. Now, for those who enjoy winter sports and activities, are there any specific precautions they should take to safeguard their heart health?
The winter activities in form of playing golf, squash, table tennis, lawn tennis, badminton in the outdoor courts, they all can continue, but the time slots have to be changed from the early morning slots or late evening slots to a mid-afternoon slots. That is very important. Swimming should be avoided because the pools, most of the pools in India are cool. But in case you have the heated pools, indoor pools, then you can go ahead and continue with your swimming exercises. But I think doing a regular walk is good, but do it in the mid-afternoon or early afternoon rather than doing it early morning or late evenings.
Wise advice. Now, considering the ongoing pandemic, how can individuals strike a balance between staying physically active and practicing social distancing during the winter?
The pandemic, hopefully, yes, is over. We are coming across a lot of flu and viral season because of winters. So during this time, I would suggest that maintain a physical distance from other people. Use of mask is a good thing. In case anybody is sneezing near your vicinity or coughing, maintain a distance and try to wear the mask. The flu shots during this season are a good option. We should get those flu shots done.
That's a great suggestion, Dr. Arora. As we wrap up our session, any final thoughts or recommendations you'd like to share with our audience?
Well, to my audience, I would want to request that during winter season, the diabetes levels will go up, the blood pressure levels will go up. Kindly take care in your diet to maintain a good healthy diet so that your diabetes remains under control. Your blood pressure readings will go higher, so your modification of your treatment plan needs to be done in consultation with your cardiologist. The heart health has to be taken care of. The incidence of heart attacks go up during winters in case you are not keeping yourself warm enough or you are not taking a precaution of taking a walk or going outside in the winters and not covering yourself well. The vasoconstriction in the coronary arteries can precipitate heart attacks or even lead on to sudden cardiac arrest. So kindly take care of it. Get your precautionary preventive checkups done. That is utmost important, so that in case you have do not have coronary artery disease, you are well taken care of, you are given the green chit. In case you have coronary artery disease but you are asymptomatic, it gets detected in the preventive checkup, and in case you are already a patient of heart disease, you are given enough precautions to take care of your heart health during the winter season. Thank you.
Thank you, Dr. Arora, for sharing your expertise with us today. And to our viewers, thank you for joining us for this important discussion on cardiac health during winters. Remember, your heart deserves the best care, especially in the colder months. Stay well, everyone.